Good morning, I'm Koshi Chet, a plastic surgeon from Taiwan. Today I'm going to present a case series about adjuvant post-diet laser therapy for post-auricular keloid excision. Among Taiwanese incidents, there is 0.15% of case annually. Compared to African, it's more higher and white is more lower. And the ear piercing related auricular keloid scar is commonly noticed. They will cause psychosomatic embarrassment and symptoms like pain and itching. In current condition, the combination therapy will be suggested, like surgical excision of the lesion with pressure application, intralesional steroid or 5-FU injection, cryotherapy or radiotherapy. But how about the role of the laser therapy? It shows compromising treatment outcome in previous study. Pulsed laser will selectively absorb by oxyhemoglobin and cause the coagulation of the microvascular of the scar. It will reduce scar hypertrophy by suppressing the fibroblast proliferation, reduce TGF-beta, and reduce connective tissue growth factor. So it may be a reasonable therapy to auricular keloid. Our case series is used the adjuvant post-diet laser by cynosure therapy for post-auricular keloid excision in China Medical University Hospital. This is a retrospective study. The patient enrolls will be know any treatment before and perform surgical excision of the auricular keloid, following by sequential post-diet laser treatment. The treatment outcome will be defined as recurrence of auricular keloid. It means any keloid returning to above 80% of preoperative size and or preoperative symptoms. And the lesion size will be evaluated with the Vancouver scar scale and Manchester scar scale by independent plastic surgeon and dermatologists. So there were 11 patients, total 12 keloid lesion enrolled. The patient is among 22 to 40 years old. And they will receive the first post-diet laser therapy 1 month after surgical excision, followed in by once a month thereafter. And the treatment parameter will be fluence of 8.5 to 9 joule per cm square, spot size of 7 millimeter, and pulse duration of 6 milliseconds. And among the patient characteristics, the mean age is about 27, and the median follow-up month is 7 months. Median time of PDL number is 4 times. Most of them is female. And most of the lesion site will be the helix of the auricular. Among all the cases in the period, there was no recurrence note. And we'll show some case of our study. This patient have the keloid on the scapa, and after excision, he have a PDL with 7 times, followed by 12 months, and there's no recurrence. The second is on the earlobe. There's a huge keloid before, and PDL with 6 times and follow up to 10 months with no recurrence. And the next is on the helix also. PDL 6 times and follow to 7 months. Sorry. And the last one is the earlobe. The last one is the biggest, worst keloid, but PDL 1 times and followed for 2 months. So in post-diet laser, it will selectively targeting the oxyhemoglobin and inhibit the fibroblast proliferation, inhibit TGF-beta to cause apoptosis. In previous studies, they also show a good non-recurrence rate of radiotherapy. So we would like to compare radiotherapy to PDL for these studies. The treatment course, PDL need once a month since 1 month after surgical excision. And the radiotherapy needs 2 to 3 consecutive days immediate post-OP. In our study, there's no recurrence, not yet. But in the previous study, the radiotherapy will have a low recurrence rate also, 5 to 10%. But in the possible complication, the radiotherapy will have the subcutaneous or chondral fibrosis or necrosis consideration. So in the laser for regenerative wound medicine, it will cause the wound reset rather than destruction and epidermal renewal. So in our case, the SS limitation, maybe we need more case need. In conclusion, compare PDL to radiotherapy, there's a comparable recurrence rate and less remarkable complication, especially the cartilage fibrosis consideration. Thank you.